Hi everyone, thanks so much for tuning in. Today we're going to be talking with Dr. Barry Jarnagin, who specializes in urogynecology, and he actually has a partnership with the Cool Springs Incontinence Institute. That's what we're talking about today, is incontinence. And it is one of those things that probably not a lot of people want to talk about, Dr. Jarnagin, but if you can, for those folks who don't know what it is, tell us or define it for us, please.
Well, incontinence is simply losing urine or stool when you don't want to. So it's an accident. Okay. And the thing that really needs to be really strongly addressed is it's never normal. So even though it becomes more prominent as we get older, it is never normal. So if anybody has incontinence or an accidental leaking, then it is not normal and it needs to be addressed.
Sure. You know, I just had mentioned a lot of people don't really want to talk about those kind of things, and sometimes not even to their doctor. Am I saying that correctly? I mean, is that true?
Absolutely. It's something that nobody wants to talk about, and I've had people referred to me for the problem, and they'll get in my office knowing that I specialize in it, and they still don't want to talk about it. So out, you know, with other people and other providers, they hardly ever, it's very difficult for people to talk about.
How do you start the conversation, if you don't mind me asking? Because even people at home can kind of maybe for a loved one, get that conversation going as well?
Well, I think it's really a matter of relationship and looking them square in the eye. Sure. And having a conversation. And, you know, I started by asking why they're here in the office and trying to see if they'll tell me. And if they won't, then a lot of times they've written it on a pre-printed form or a pre-printed questionnaire, so I can look and then I can say, it looks like you're suffering from this problem, and you know, would you like to explain kind of how it bothers you?
Okay, what causes incontinence? There's
multiple causes, and that's one of the big things that people don't recognize. They think it's only, you know, it is a problem in and of itself. It's really a symptom of a much greater problem, and that problem can be anatomical, generally related to childbirth is the biggest cause, although other surgeries can cause that. Or it can be neurologic. There's many women who come in who have back disease or some other kind of problem, or it can be, again, related to childbirth where nerve injury occurred at childbirth. So it can be anatomical or it can be functional. And so that's part of what I try to do, is define and determine which of those it is so that we can best direct treatment in that direction.
All right, when you're asking your patients, you know, what seems to be the issue today or why did you come here, obviously they're going to be talking about what's happening. But what kind of symptoms should somebody be looking out for at home to lead them to believe this might be me, I might be dealing with incontinence?
So there's some basic symptoms that tend to occur, and one set of symptoms are related to laughing, sneezing, coughing, jumping on the trampoline with your kids, jogging, activity-related incontinence. Then there's a totally different type of incontinence that has nothing to do with activity, but is related to urge and urge-type incontinence, where they get the sensation they have to go, and then they just simply can't make it to the bathroom in time. That's the type that you're running the water, you're washing dishes, you're running the water, or something like that, or you hear water running, and all of a sudden it makes you kind of tighten up and try to make it to the bathroom and can't, or you're at the front door trying to unlock it and you just can't get it unlocked in time. But it's those kinds of things. It's spontaneous. It happens without any kind of warning and that sort of thing.
Okay, you had mentioned that obviously people who have this condition usually have maybe gone through some sort of surgical procedure or have had a child or had some sort of issue as far as, you know, a nerve issue. But as we age, is it something obviously that we should be aware of as well?
Absolutely. And people ask all the time, why didn't, if it's related to childbirth or if it's related to X, Y, or Z, why didn't it occur then? And it just takes time and as time goes on, that small injury that occurs at childbirth or at whatever, over time tends to get worse. And quite frankly, as we get older, our ability to compensate for those injuries that occur become less. And so the symptom may occur 20 years or so, give or take, after the event that actually caused it. And so they need to be looking for that leaking when they laugh, sneeze, cough, or that urge or that spontaneous leak that they can't control.
Absolutely. And when people experience this, Dr. Jarnagin, obviously they're going to want to know right from you the fastest remedy. What can I do? Is there a medicine I can take? Is there a treatment option for me? Let's talk about going from simple to even surgery if possible.
So there's a few things that help no matter what type of incontinence you have. And that is pelvic floor exercises. And that can be as simple as people have heard of Kegels all their life, but
yes,
tightening down and trying to do that. Now, unfortunately, many women, by the time they get to my office, they lose that ability to do that. Their brain thinks they're doing it, but their body is not responding. And so those women, or more women, may want to get into formal physical therapy. And that's a good way to start, is trying to get the muscles rehabbed and regenerated. So to go from there, then there's behavioral things you can do. You can kind of put your body on a schedule, and sometimes that will offer value. Looking at your diet, seeing what things tend to cause issues. Sodas, carbonated beverages tend to get people to go more frequently. And so if you're drinking a lot of sodas and you cut back, that can make a big difference. Coffee is another thing that can stimulate. Teas can stimulate. So you can kind of look at what you're eating and drinking that may be contributing to the problem. So those are kind of the basic things that kind of help no matter what kind of problem you're having. The other thing, so then when you get beyond that, then it becomes more focused on what's causing the problem. And then you can go into, depending on the type, there are medications that may offer some value. If that doesn't work, then you can kind of move into what's called neuromodulation, which is where we actually try to get the communication between the brain and the bladder better. And that's where we get, there's an office procedure that can be done that's kind of like 21st century acupuncture. And then there is a pacemaker type device that is an outpatient procedure that we do under sedation that can go in, and much like the pacemaker that's in the heart, that kind of regulates the nerve and the communication to make the heart that's beating too fast slow down and the heart that's beating too slow to speed up. The pacemaker for the bladder does a similar thing. It can regulate and modulate the ability to the bladder to contract effectively and relax effectively. And then there's Botox to the bladder. And women all know about Botox.
Yes, for different reasons, obviously.
And we're putting Botox everywhere now.
Yes.
And so we can now put Botox into the bladder, and that will tend to relax the bladder so that that urge, that spontaneous leak is limited and doesn't occur. So that's kind of that side of it. And then the other side is, if you're looking at leaking when you laugh, sneeze, cough, and activity, there too is an office procedure that we can do. It's called bulking. It kind of tightens down on the urethra so that it gives the urethra a little help of resisting that urine from going by. And then there's the outpatient slings that can be done. And there's a lot of things that have occurred in the newspaper, et cetera, about slings, but slings really are overall pretty safe, and actually really safe and fairly easy to do. And recovery time is very short. They can come in and have it done, and I've had school teachers have it done at the end of a week and be back teaching school by the middle of the next week. So, so it can be something that can be quite effective. There's also other surgeries that can be done to help lift and help with the incontinence of activity.
All right, terrific. So we know what can be what can be helpful if you have this issue that you're dealing with. Dr. Barry Jarnagin, thank you so much for your time today.
Absolutely. Thank you for having me.